All right, we're gonna do the bony structures and the muscle movements of the knee joint. We have Caden here as the demo. All right, to start, we have the lateral and medial femoral condyles. There, if you go to the patella, which is right here, just a little above, right at the base of the femur, you have the condyles, the medial one. It's on the medial side, the lateral one is around right here. And then you have the lateral and medial femoral epicondyles, which is just superior to the condyles. So again, medial is on the medial side, lateral is on the lateral side. Next we have the trochlear groove, which you can feel if Caden flexes his knee on the back. And then we have the lateral and medial tibial condyles. So that's almost the same location, just on the tibia. So we have our tibia, on the outside right here. We have the medial tibial condyle and the lateral tibial condyle. After that, we have the medial collateral ligament and the lateral collateral ligament, which the medial collateral ligament is on the medial side of the knee, and then the lateral collateral ligament is on the lateral side of the knee, about right here. Next we have the Gerdy's tubercle, which that is on the lateral side. If you go to, we have your tibia, your tibial tuberosity is about right here. If you go a little superior and then to the left, or to the outside, you have your Gerdy's tubercle. And then on the other side, you have the pes annulus. They're about like right here. And then yeah, the tibial tuberosity is right here. Next we have, we pointed out the patella, it's the whole thing. The patellar tendon is the tendon that runs along the patella and extends downward. Next we have the patellar pulls. So the superior patellar pull pulls superiorly like this, and the inferior patellar pull pulls inferiorly like that. And then we have the tibia, the body of the tibia, and then the fibula, which is like this. And Caden's head of his fibula is really prominent right here. It's really easy to palpate. Next we have the muscles. And we are going to use the chair. You don't want anyone falling down or getting hurt today. So first we have the quadriceps muscles. Caden's are really easy to palpate. We have the rectus femoris, which is the middle one. And then we have the vastus medialis and the vastus lateralis. And then underneath the rectus femoris, we have the vastus intermedius. So it's just deep to it. And then they all perform pretty much the same thing. They all do knee extension, so just like that. And then the rectus femoris also does hip flexion and anterior pelvic rotation. Next, we have the biceps muscle, or the hamstring muscles. So we have the biceps femoris is the most on the outside, and then the semimembranosus and the semitendinosus. So they're all the hamstrings. Let's make up the hamstrings. The biceps femoris right here does knee flexion, which everyone knows, and hip extension, posterior pelvic rotation, and then external rotation of the knee and hip. And then the semimembranosus and semitendinosus perform the same things. They do knee flexion as well, just like the biceps femoris, hip extension, posterior pelvic rotation, and then internal rotation of the knee and hip. Next we have the gracilis muscle. So again, if you can turn around, the gracilis is right in here. It goes like down like that. That does knee flexion and internal rotation of the knee. And then we have the popliteus muscle. It's on the back of the knee. It's like right here. And that does knee flexion and then internal rotation during knee flexion. And lastly, we have the gastrocnemius, which is about right here. And it's like the big calf muscle everyone knows. And that does knee flexion and plantar flexion of the knee.